After the age of 60, taking medication is no longer as simple as before. Many elderly people have to take 3 to 7 types of medication at the same time every day to treat blood pressure, cardiovascular disease, diabetes, joint pain. But did you know that the wrong way of taking medication, such as taking it at the wrong time, taking it on an empty stomach, stopping the medication on your own, is causing thousands of elderly people to be hospitalized every year? In today's video, we will share 6 important notes when taking medication that anyone over 60 years old needs to know to avoid dangerous complications from sudden hypoglycemia, hypotension, to liver failure, kidney failure. This is knowledge compiled from pharmaceutical experts, elderly doctors, along with experience in caring for thousands of patients at home. Each note is a shield to protect the heart, brain, and overall health of the elderly from the silent risks of taking medication incorrectly. 1. Taking medication without consulting a doctor, a double-edged sword for the elderly. Taking medication without consulting a doctor is one of the leading causes of dangerous complications and hospitalization in the elderly. After the age of 60, the body undergoes many changes related to drug metabolism, absorption, and excretion. If the elderly still maintain the habit of buying medication themselves like when they were young, or worse, taking it on the advice of acquaintances, the risk of side effects, drug interactions, or incorrect dosage is very high. In reality, many elderly men and women with high blood pressure, diabetes, joint pain, etc. often go to the pharmacy to buy the medications they used before without knowing that their health condition has changed. There are even cases where they reuse old prescriptions from a few years ago, not realizing that they now have a new disease or are taking other medications. Such small changes can create a serious domino reaction, causing electrolyte disturbances, hypoglycemia, acute kidney failure, or gastrointestinal bleeding. A typical example is the case of Mr. T, 68 years old in Hanoi. He had a history of stomach pain and high blood pressure, and was prescribed medication by his doctor to stabilize it. However, because he felt better, he stopped going for follow-up visits and went to the pharmacy to buy medicine on his own when the pain returned. Unfortunately, the pain reliever he used, NSAIDs, can make stomach ulcers worse, especially when used for a long time and without stomach-protecting medication. After a few months of self-medication, Mr. T suffered from gastrointestinal bleeding and had to be hospitalized with severe blood loss. Even more dangerous is when the elderly take many medications at the same time, both prescription and non-prescription, without a doctor's supervision. In medicine, this is called polypharmacy, and is one of the main risk factors for adverse drug interactions. One drug can increase or decrease the effectiveness of another. Some drugs, when combined, can even harm the liver, kidneys, cardiovascular system, or nervous system. Many elderly people also tend to believe in traditional medicine, traditional Chinese medicine, or functional foods that are passed around online. These products, if of unknown origin, untested, or if you don't know how to use them in the right dosage, can cause serious consequences. Some traditional Chinese or herbal medicines may contain corticosteroids, heavy metals, or ingredients that interact with Western medications. This is especially dangerous if the elderly are being treated for chronic diseases, such as kidney failure, cardiovascular disease, or are taking anticoagulants. Not to mention the dosage issue. Elderly people often have reduced liver and kidney function with age, causing the elimination of drugs to slow down. Therefore, a safe dose in young people can become a dangerous dose in the elderly if the dose is not adjusted properly. Even commonly used drugs such as sleeping pills, blood pressure-lowering drugs, or diabetes drugs can cause accidents, fainting, or sudden hypoglycemia. Therefore, the first and most important advice for people over 60 is, do not arbitrarily use any medicine, including old or familiar drugs, without consulting a doctor or pharmacist. In addition, regular checkups are recommended to reevaluate the effectiveness of the drugs being used, check liver and kidney function, and adjust the dose accordingly. Having a list of medications currently being used, clearly stating the dosage and time of use, is also necessary. If there are many different doctors treating you, for example, endocrinologists, cardiologists, musculoskeletal doctors, etc., The patient or family members should proactively inform the current list of medications to avoid duplication or drug interactions. In short, self-medication, whether it comes from habit or subjectivity, is a major threat to the health of the elderly. We need to change our mindset. Do not consider medication as a quick solution to all symptoms, but consider medication as part of an overall treatment plan that needs to be monitored and adjusted regularly to suit the changing physical condition of the elderly. 2. Taking multiple medications at the same time without control. The risk of silently sending the elderly to the hospital. After the age of 60, most elderly people have to live with many chronic diseases, such as high blood pressure, diabetes, bone and joint diseases, dyslipidemia, stomach pain, insomnia, etc. Therefore, taking multiple medications at the same time, also known as polypharmacy, is almost inevitable. However, the worrying thing is that when the elderly arbitrarily combine multiple medications without medical control, the risk of hospitalization due to drug interactions, overdose, and side effects increases dramatically. Why is taking multiple medications dangerous? When an elderly person takes 5 or more medications every day, the possibility of adverse drug interactions is very high. Each drug has a different mechanism of metabolism, absorption, and excretion, and when these mechanisms collide in the body, they can increase toxicity, reduce the effectiveness of the drug, or cause serious side effects. For example, if you take anticoagulants, such as aspirin, and NSAIDs, such as diclofenac, at the same time, the elderly are very susceptible to gastrointestinal bleeding. Or if you are treating blood pressure with diuretics, and at the same time, taking joint pain relievers, the risk of kidney failure will increase very quickly. In addition, liver and kidney function declines with age, causing the drug to be excreted more slowly, leading to accumulation in the body. This further increases the risk of drug poisoning even though the dose is still normal in young people. Warning symptoms, often overlooked. Older people often do not have obvious drug interactions or side effects. Instead, there are vague symptoms such as prolonged fatigue, drowsiness, headache, dizziness, easy to fall, confusion, mild confusion, personality changes, stomach pain, loss of appetite, weight loss, rapid pulse, sudden increase in blood pressure or abnormal decrease in blood pressure. Many people and even family members often think it is due to old age or relapse of old illness, without thinking about the possibility that the drug is causing harm. How to prevent? Record the entire list of medications you are taking, including functional foods, oriental medicine, massage medicine, etc. This list should be updated regularly and brought with you to every medical examination. Only take medication as prescribed by your doctor. If you want to add any type, even supplements, consult your doctor or clinical pharmacist to assess the risk of interactions. Do not stop taking the drug on your own when you feel better, or heard others say this drug is harmful. Stopping medication suddenly can cause drug shock or relapse. Divide the time to take medication reasonably. Do not take all medications at the same time, especially medications taken on an empty stomach, medications taken after meals, and medications that need to be spaced far apart. Closely monitor unusual symptoms after adding a new medication. If you feel unusual, fatigue, dizziness, nausea, confusion, etc., you need to see a doctor soon and bring all the medications you are taking for the doctor to reevaluate. Have regular checkups and check your liver and kidney function regularly, especially if you are taking medication for a long time. Advice from doctors. According to geriatric experts, the use of multiple medications in the elderly is unavoidable. However, smart medication management, including taking the right dose at the right time, understanding the uses and risks of each medication, is the best way for the elderly to reduce the risk of hospitalization due to side effects. The more medications, the more simplicity, transparency, and close medical monitoring are needed. Don't let the pills that are expected to cure silently harm your body, just because they are not used properly. 3. Not following the correct dosage and time of taking medicine, a double-edged sword for the elderly. When entering the age of 60 and above, the elderly's body becomes much more sensitive to drugs. Liver, kidney, and cardiovascular functions all decline, causing the metabolism and excretion of drugs to be slower than in younger people. Therefore, not following the correct dosage and time of taking medicine can lead to serious consequences, even emergency hospitalization. Why do the elderly often use medicine incorrectly? There are many reasons why the elderly do not use medicine as directed. Forgetting to take medicine. Age is accompanied by memory loss. Many people often forget to take doses, or take double doses, arbitrarily changing the dosage. Seeing that the disease seems to be better, they arbitrarily stop taking the medicine or reduce the dose. Conversely, when it is not effective, the dose is doubled without consulting a doctor. Not understanding the instructions. Due to not listening clearly to the instructions, not being able to read the small print on the medicine label, or not understanding complex medical terms. Fear of side effects. Some people are afraid of becoming resistant to the drug or having complications, so they deliberately reduce the dose or interrupt the treatment. 2. Unpredictable consequences if taking the wrong dose. When not following the correct dose and timing, the treatment effectiveness is significantly reduced. In many cases, the consequences are even more dangerous than the original disease. Increased risk of side effects. Overdose can easily cause liver poisoning, kidney failure, hypotension, arrhythmia, or gastrointestinal bleeding. Drug resistance, especially with antibiotics. Taking the wrong dose can easily make bacteria resistant to the drug, making it very difficult to treat later. Recurrence of the disease. Missing a dose or stopping the treatment makes the disease uncontrolled, easily recurring more severely. Costly treatment. Not being cured, having to be hospitalized, prolonging treatment and increasing costs. 3. How can the elderly take medicine properly? Some practical solutions to help the elderly comply with the correct dose and time of taking medication. Use a pill box divided by day and time to avoid confusion or forgetting. Write clear notes in large, easy-to-read letters and stick them in a visible place in the house. Set a timer on your phone to remind you to take your medication on time. Family members should remind you and check it every day, especially those with memory problems. Do not stop or change the dose on your own. Consult your doctor if you want to adjust. Not complying with the correct dose and time of taking medication is a common but dangerous mistake in the elderly. Just one pill taken at the wrong time, or an unintentional double dose, can become a threat to health. The elderly and their families should pay special attention to their daily medication habits to avoid unnecessary risks. This is not only to protect their health, but also to protect the quality of life in old age. 4. Not paying attention to the time of taking medication. A common mistake among the elderly is not paying attention to the correct time of taking medication. A seemingly small thing, but has a huge impact on the effectiveness of treatment. Many types of medication need to be taken at specific times of the day to ensure maximum absorption or avoid unwanted side effects. For example, blood pressure medications are often recommended to be taken in the morning to better control blood pressure during the day. Meanwhile, sleeping pills or sedatives should be taken in the evening to avoid causing daytime drowsiness, affecting daily activities. Some medications need to be taken after meals to avoid stomach irritation, while others need to be taken before meals to increase absorption. Failure to comply with the time of taking medication can lead to reduced treatment effectiveness, increased risk of drug-food interactions, or serious side effects. For the elderly, this is even more dangerous because their bodies have reduced ability to adapt. Therefore, the elderly should have a reminder board to take medicine, or have relatives help them control the exact time of taking medicine every day. This is a small step but contributes significantly to protecting health and avoiding hospitalization due to unnecessary medication errors. 5. Not checking liver and kidney function regularly. In the elderly, liver and kidney function, the two main organs responsible for metabolizing and eliminating drugs, often decline over time due to the natural aging process or due to chronic diseases such as diabetes, high blood pressure, gout, hepatitis, etc. However, many people are still subjective and do not check liver and kidney function regularly, leading to the use of drugs that are no longer suitable for their current physical condition. This is a serious mistake, but is often overlooked. When liver and kidney function is impaired, the ability to break down and remove drugs from the body is reduced. This causes the drug to stay in the blood longer, increasing the risk of accumulation, poisoning, or leading to serious side effects. For example, some pain relievers, anti-inflammatory drugs, lipid-lowering drugs, or antibiotics, if not adjusted to the appropriate dosage for liver and kidney function, can cause serious damage to these organs. In particular, in the elderly, the symptoms of drug poisoning may not be obvious, easily confused with signs of old age, such as fatigue, drowsiness, dizziness, insomnia, loss of appetite, etc. This slows down the detection and treatment process, which can lead to acute liver failure, kidney failure, and even death if not intervened promptly. Regular liver and kidney function testing not only helps assess the safety of drug use, but also helps doctors adjust the appropriate prescription for each stage of health. Basic tests such as SGOT, SGPT, creatinine, urea, eGFR, and urinalysis are necessary and should be performed at least 1 to 2 times a year, or more frequently if the patient is taking medication for a long time. Elderly people and their family members need to understand that taking medication is not simply about taking the right medication at the right time, but also taking it according to the body's condition. A weak liver or a failing kidney cannot process medication as well as when they are healthy. Only regular checkups can help see that. In short, to ensure effective treatment and avoid dangerous complications, the elderly need to proactively check their liver and kidney function periodically, especially when they are taking multiple medications at the same time or have unusual signs while taking medication. This is an important step in protecting their health and maintaining quality of life in old age. 6. Not paying attention to unusual signs when taking medication. For the elderly, taking medication is an almost daily occurrence to treat chronic diseases such as high blood pressure, diabetes, cardiovascular disease, arthritis, etc. However, a very common and potentially dangerous mistake is not paying attention to unusual signs when taking medication. This is one of the main reasons why many elderly people suffer from accidents, are hospitalized, or even die in completely preventable situations. As the body ages, liver and kidney function, the organs responsible for metabolizing and eliminating drugs, decline significantly. This causes drugs to stay in the body longer, easily causing toxicity or increasing the risk of side effects. Some unusual symptoms, such as prolonged fatigue, nausea, dizziness, rash, swelling of the limbs, shortness of breath, diarrhea or constipation, etc. are often overlooked because the elderly or their families think it is due to old age or underlying diseases. More dangerously, some drugs can cause serious side effects such as stomach bleeding in people taking anti-inflammatory drugs, liver damage in people taking lipid-lowering drugs, or acute kidney failure due to diuretics, antibiotics, etc. If the signs are not recognized early and the drug is stopped promptly, the consequences can be very serious. Some elderly people also have the habit of arbitrarily increasing the dose or prolonging the duration of medication when they see that the disease has not been cured, or conversely, suddenly stopping the drug when they see that they have improved. These actions make it more difficult to monitor the effects of the drug, and at the same time obscure the abnormal signals that the body is emitting. To ensure safety when taking drugs, the elderly and caregivers need to be instructed on how to observe and recognize dangerous signs. Taking notes of changes in the body during the use of drugs, drug diary, is also an effective measure to report to the doctor during follow-up visits. In addition, you should never buy new drugs, change drugs, or stop taking drugs without professional advice. Conclusion: ignoring unusual signs when taking drugs is a dangerous mistake, especially in the elderly. Even small reactions can be a warning from the body. Listen to your body more, check regularly, return for checkups on time, and inform your doctor of any changes for timely treatment. That is a simple but effective way to protect your health and prolong your life. Old age is a stage where each pill you take can determine whether you live a healthy or miserable life. Therefore, do not be subjective. Whether it is a vitamin, supplement, or prescription drug, people over 60 need to know clearly what they are taking, the dosage, whether they need to eat first or not, and whether they interact with other drugs. If you find this video helpful, please share it with your loved ones, because many seniors are still taking medicine out of habit, without knowing that this habit is harming their bodies every day. Subscribe to the channel to receive more videos on nutrition, health, and lifestyle for people over 60. Thank you for watching, and wishing you good health and happiness every day.